Got it. And if I remember correctly from your records, you recently had a knee arthroscopy. Is that right? Just confirming we're on the same page.
Yes, that's correct.
Okay, wonderful. Thank you for confirming, Sarah. Now, how are you feeling today, generally speaking? And on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable, what would you say your pain level is right now in your knee?
I'd say maybe a 4. It's sore, but it's manageable.
A 4. Okay, that's good that it's manageable. It's very normal to feel some soreness after a knee arthroscopy, so that sounds pretty typical. Are you noticing any swelling, redness around the incision, or maybe any fever? And how does the incision site itself look and feel to you?
No fever, but the swelling's a bit more than yesterday.
Okay, no fever. That's good to hear. A little bit of swelling, especially early on, can definitely be expected after surgery, Sarah. Are you keeping it elevated when you can, and maybe applying ice packs as directed?
Yes, I'm applying ice packs, and I've been trying to move around the house a little bit.
That's excellent, Sarah. Keeping it elevated and using ice packs really helps with the swelling, and gentle movement around the house is also good for circulation, as long as you're not overdoing it. It sounds like you're doing all the right things. Now, regarding your medications, are you taking everything as prescribed? And have you had any difficulties with them, like side effects or remembering to take them?
I have been taking my medications consistently, and no, I haven't experienced any side effects yet.
That's really great to hear, Sarah. Staying on top of your medications is so important for a smooth recovery, and it's wonderful you're not having any side effects. You mentioned moving around the house a bit. How is your overall mobility right now? Are you able to move around comfortably with any assistance, like crutches or a cane, if you were given them? And are you able to put weight on your leg as advised?
Yes, I'm able to put weight on my legs, and I have been using crutches to move around the house.
That's wonderful, Sarah. Being able to put some weight on your leg and using your crutches as instructed is a really positive sign for your recovery. It sounds like you're progressing really well. Just to be thorough, I do want to remind you of a few things to watch out for. If you notice any sudden, severe increase in pain that isn't helped by your medication, a lot of new redness or warmth around the incision, pus draining from the incision, or a fever over 101.5 degrees Fahrenheit, please don't hesitate to contact us right away or seek medical attention. These are what we call red flags. Based on what you've shared today, everything sounds pretty normal for this stage of recovery. However, if you'd like to speak with a registered nurse about the swelling or anything else, I can certainly arrange for one to call you back within the next few hours. Would you like me to do that for you?
No, thank you. I just want to make sure that the swelling wasn't abnormal.
Okay, I understand, Sarah. It's perfectly natural to be a little concerned about swelling, especially after surgery. But based on what you've described, and since you're using ice and elevation, it really does sound like a typical part of the healing process. Please do keep an eye on it. And if it gets worse significantly, or if you develop any of those red flags we just talked about, please reach out to us. For now, just continue to rest, keep that knee elevated when you can, and follow your post-op instructions. You're doing great with your recovery. I'll also send you a quick summary of our call to your email, just for your records. If anything changes, or if you have more questions, please don't hesitate to call us back anytime. Is there anything else I can help you with today, Sarah?
No, thank you. I appreciate all that you've done.
You are